Thalassemia is the world's most common genetic blood disorder, which is an inherited disease passed down from parents to their children during development, affecting the child's red blood cells. In this video, we will focus on beta thalassemia, which is the most clinically relevant form of the disease. Thalassemia is caused by an abnormality or mutation in one of the genes involved in hemoglobin production, which is a blood protein that carries oxygen within the blood. The mutation occurs when two carriers of the disease conceive a child. If this is the case, there is a 25% chance of the child developing thalassemia, a 25% chance of the child not inheriting thalassemia, and a 50% chance of them becoming a carrier. Before understanding the pathology of thalassemia, we must first appreciate the cells involved. The mutations causing thalassemia affect the beta globin gene, which are activated producing the oxygen-carrying protein known as beta globin chains or hemoglobin. A single beta globin gene lies on the chromosome 16 in our bodies, promoting synthesis of hemoglobin in a healthy person. Lastly, red blood cells are another important cell that are affected during thalassemia. The oxygen-carrying proteins lie on the red blood cells, carrying the thalassemia is caused by mutations leading to damage of red blood cells, leading to anemia, which is the deficiency of red blood cells or oxygen-carrying proteins within the bloodstream. There are three main types of mutations that can lead to the development of thalassemia. Firstly, the most common mutation stops the production of beta globin, meaning that there is a deficiency in the number of oxygen-carrying proteins within the blood. Secondly, mutations may lead to the formation of abnormal oxygen-carrying proteins that work alongside and replace some of the normal functioning proteins. This leads to a reduction in the carrying potential of the cells, therefore leading to thalassemia. Lastly, mutations to the beta globin promoters can lower the rate of beta globin genes to copy, leading to lowered numbers of oxygen-carrying proteins being developed. These deficiencies damage the outermost layer of the red blood cells, or their membranes. These mutations lead to a range of pathological issues, including oxidative injury due to a lack of oxygen in the blood and around the body, and a buildup of reactive oxygen species, which thrive in these environments and can lead to damage, as well as cell death. These complications are the product of the low number of oxygen-carrying proteins and deformation of the red blood cells. So, why is this information important for parents who are looking to have children? Due to thalassemia being a genetic disease, screening for carrier status is important for future parents to uncover the risks of their child developing the disease and preparing them for the risks, as without treatment there is a high risk of death within the child's first 5 years of life, usually dying within the first 3 years. But with treatment, life expectancy is approaching normal. Do you know your carrier status? Book an appointment with your GP to find out.